Okay, we've got 5 o'clock. I'd like to call the Health Committee meeting to order. Is good to go? All right. Welcome everybody to the April meeting of the Albany County Legislature's Health Committee. One second here. I'd like to have Rebecca, could you call the roll?
Sure, Mr. Chairman. Ray Joyce.
Present.
Reedy.
Here.
Beston is excused. Collins.
Here.
McLean Lane.
Here.
Miller.
Present.
Moriello.
Here.
Ward.
Here.
And Willingham is excused. 7 present, Mr. Chairman.
All right, thank you, Rebecca. Under previous business, can I get a motion to approve the previous meeting minutes? Motion made by Ms. Ellie McLean Lane, second by Mr. Reedy. All in favor?
Aye.
Any opposed? Under current business, number 2, authorizing an agreement with the New York State Department of Health regarding the Immunization Action Plan Grant Program. And tonight, we have Mr. Ransomore filling in for Dr. Whalen.
Hi.
Good evening. How are you?
Good, how are you?
Good, thanks.
Dr. Whelan's at a conference, so she's happy to present. County Health Department is requesting permission to accept a grant from the New York State Department of Health for the Immunization Action Plan Grant Program. The program is to remove barriers for immunization to ensure that 90% of all children within Albany County are completely immunized by their 2nd birthday. The amount of the grant is for 5 years, $784,360. Each year being approximately $156,872.
Mr. Moore, any questions from the committee? Mr.
Just a
Moriello?
quick question. How much is it per year, did you say?
$156,872.
Okay, all right, because I noticed, just looking at this real quickly for like April 1 through December 31st of last year, we served 97 individuals, 133 vaccines, and 50 bags of education material and pamphlets. Do we have any idea how much this costs per person? How successful is this program?
Well, the cost per person is 82% funded by state funding.
Well, I know that, but I mean, cost per person, like, I mean, how much does it cost per person to vaccinate them? What's it cost for, we provided an additional, we served 97 individuals for like 8 months, provided 133 vaccines. Do we know how much this is costing per individual? Did we analyze what the cost is?
Okay, I don't know where you're getting this figure. I don't have those with me.
Okay,
but,
this is something we were able to look.
Yeah, no, that's
Yeah.
fine. I can look into that for you. It would depend on the number of vaccines. Obviously, given to each child. That's something I can look up for.
Okay, I mean, I realize this money's coming from the federal government and the state government. No cost to the county, but I just want to make sure that the money's being spent. And do we have any idea how successful this is?
Yeah, it's very successful. The goal of the grant is over 90% of the children within Albany County to be vaccinated. I discussed this with the Director of Nursing this afternoon. We have met that goal every year for this. The program has been in existence for at least 25 years, perhaps since the 80s, since before the Director of Nursing with the health department. So all in all, I'd say a very successful program.
Okay, all right, thank you. Thank you.
Any other questions,
Just a
Mr. Miller?
follow-up for Frank, I just to understand, was that stuff in the backup or something you just asked?
This was in the backup that we, our office analyzed.
Okay, gotcha. Thank you.
What types of immunizations are we talking about?
Any childhood vaccination, that they would receive by the end of their 2nd year, anything required to attend public school, we see what we have. So MMR vaccine would be one of these. I can't list off the top of my head.
Polio?
Polio.
Ms. Willingham?
Yeah, I just, think it was this morning, I was listening to something about, some vaccines for kids. And I don't know if it had anything to do with COVID or not, but it was talking about they were changing the vaccines for children. And I was just wondering if this was part of it or anything to do with COVID.
No, this has nothing to do with COVID vaccinations. Those are separate grants that the county has for those.
And so you said this is strictly for the vaccinations that they would need to get into school?
That's one of the things that they're all childhood vaccinations that they would need by the 2nd birthday. The department does work with school nurses to catch children who haven't met their vaccination status so that they can remain in school. That's one of the things.
That's all. Okay, so now, most kids go to their pediatrician to get their shots. So where are these,
They can, and the department works with primary care physicians for the pediatricians for children who may not have already gotten their vaccines by their second birthday. It doesn't necessarily mean that all children are getting their vaccinations at their primary care pediatrician.
so who gives these shots?
Nurses, I mean, I can ask the director of nurses specifically who does, but nurses at the department.
Okay, and how do we advertise that?
It's not advertised per se, but they work with primary care physicians who, catch kids who may fall through the cracks, who haven't received all their necessary vaccinations. They work with other community leaders. They also work with school.
So they send them down to the health department to get their immunizations? That's.
Yes, on site at the health department.
Okay, okay. And so, how many is this?
This is for 5 years for $784,360, so $156,000 and change per year.
$156,000. I wasn't really talking about.
97 individuals they did.
Okay.
Correct?
Yeah, I'm not sure where Whitmore got that from, but I can look into that to verify.
And so, when you said 97, so a lot of these shots, there's like 2 involved, with some of them? Okay, so it would be, so that they could get both, the shot, and I guess there's a booster, whatever you call it, that goes along with the, some
Yes.
of these.
Yeah, the health department does this as part of the procedure to get the flow vaccine.
How do you coordinate keeping track of, like, okay, so, all my children have the same pediatrician, okay? And so, whenever they got ready to do something in school or whatever, they went straight to their pediatrician, okay? And he knew them and he had their records. So how do you keep track of kids who may start out with, I don't know, St. Peter's Clinic or child, whatever, and wind up down at the health department? How are their records kept track of?
I can't speak to records that children or parents may bring with them. Now, those are kept track of, but I do know that we document all the vaccinations that we give at the Department of Health. And one of the reasons that this program exists is to catch children who fall through the cracks who may have not gotten their full vaccinations. And one of the reasons they need these is to attend school.
And so you know that because are these immunization records kept on file with the health department?
Yes, I can verify that.
Would you please?
Yeah, sure.
I would just be interested to know that. Okay, thank you, Jim.
Sure, Ms. Willingham. Any other questions from the committee? Hearing none, I think Ms. Ellis and McLean Lane wants to be added to this.
Absolutely.
Okay. Can we get a motion to remove? Motion made by Ms. Allison McLean Lane, second by Mr. Ward. All in favor?
Aye.
Any opposed? Thank you, Mr. Moore.
And thank you for doing this program. It's very important.
Next up, I think we have Dr. Giordano. How are you?
Good evening, Mr. Chairman.
How are you tonight, Dr. Giordano? We have number 3, amending the 2023 Department of Mental Health budget personnel changes.
Yes, so we're here tonight to ask permission to amend our 2023 budget. This is a strategy to recruit and retain social workers. We've brought to you before similar proposals in the past. What we are hoping to do here is to redirect funds from a long-time vacant social work position and increase the salaries of 5 other long-term vacant social work positions to increase what we're calling the career trajectory for entry-level social workers. And we believe we've been successful in the past in either recruiting folks that we wouldn't otherwise have or retaining people who are on the way out the door because they thought they were going to get higher salaries, usually with the state. So we believe this is a strategy that has worked in the past, and we're asking permission to do it.
we have any questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Miller, second by Ms. Allison McBain Lane. All in favor?
Aye.
Any opposed? Unanimous.
Thank you very much.
Thank you. Next up, I think I saw Mr. Kavanaugh here. Yep. Number 4 is authorizing an agreement with Ellis Hospital regarding morgue and laboratory services. Tonight we have Mr. Tim Kavanaugh.
Chairman?
How are you tonight?
Hi, how are you?
How are you? I'm good. Good to see you. Any comments or questions regards to the Ellis contract? Wanda?
Any questions from the committee?
I thought you retired.
It's coming. Actually, this is the last time you guys will be seeing me,
Oh,
Yeah, we'll call you before that.
after 36 years.
Mr. Miller?
Just, well, what was, is this an increase from before? I mean, I can see what the number is, but it doesn't tell us.
There is an
what it was before.
increase with Ellis. It was a $200 increase. It was around $1,000. Now it's $1,200 per case. Albany Med did submit a proposal of $2,000 per case. Based on the amount of cases we do, about 300 a year, we're still saving probably $300,000 a year by using Ellis. Ellis has expanded their facility. They have definitely improved it. We still have a little agreement with Albany Medical Center. Any overflow cases, we use their refrigeration at no cost. So
That's good. Do you know what the total contract was last time, though? This is 430 now. Do you know what it was previously?
I don't offhand,
Okay.
no. I don't offhand.
Thank you.
But we do about 300 autopsies a year, and there was only 2 proposals, so we're happy with those.
Any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Ward, second by Mr. Reedy. All in favor?
Aye.
Any opposed?
Thank you very much.
Unanimous.
Mr. Chair, may I just add, in case it is the last time we see Mr. Kavanaugh here.
You're gonna beat
You
me to
know,
it, but go
I've
ahead,
been
Mr. Ward.
here 28 years, he's been here 36, longer than me. But I just want to thank him for his
The only
service.
other guy is this guy right here, Frank.
Absolutely.
78.
But no, you guys always been great to work with. Difficult job being a coroner in Albany County, extremely
I know
difficult.
I've been out with you a few times.
I have
Sean's
been
out
too.
with me. I've dealt with Wanda. You know, one thing I learned out there right from the, originally when I was asked to be coroner, I'm like, I can't do that job. 1987, they said, oh, you can. You know, so I learned to treat everybody the same. Doesn't make any difference where they are or where they die in Albany County. And I really feel good when they do retire from the county here, knowing that I did a good job as coroner.
Thank you.
And I'm not just saying that because of me, I know I've done a good job, so.
Ms. McLean Lane?
Always a pleasure working with you
I
guys.
just want to say that one thing that I learned when I went out with Tim is he said, be kind to everybody because this is the worst day of their life. And I will take that
Yes.
advice
Yes,
and
you-
I will
You
push
did a
that
ride
forward.
along one night, I always offer to
Yeah.
anybody else.
I brought my bug spray
Sean's
just in
been there.
case.
You know, I've dealt with Wanda in many cases, and it's a difficult job,
Yeah.
difficult job. But,
Well, thank you.
okay, thank you very much,
Thank you.
appreciate it.
Thanks,
Have a good
Jim.
night.
That's all we have on the agenda. Can we get a motion to adjourn?
Yeah.
Motion made by Mr. Ward, second by Ms. Willingham. All in favor?
Aye.
Aye.
And Ally, you meant